Basic Pharmacology for 3rd semester Faculty of Medicine. Basic Pharmacology. 1. Introduction to Pharmacology. A definition of pharmacology. Pharmacology is the science that studies drugs and how they interact with the body to produce both therapeutic and toxic effects. Its main focus is on the mechanism of action of drugs, their distribution in the body, their effects on organ systems, and how drugs are metabolized and excreted. B. Objectives of pharmacology. Understanding the basic principles of drugs and their effects on the body. Providing the foundation for selecting the right drug based on indications, dosage, and potential side effects. Understanding the basic mechanisms underlying drug use in clinical treatment. 2. Classification of drugs. A based on their source. 1. Natural drugs. Source: plants, animals, or microorganisms. Examples: morphine from the opium poppy, insulin from animal pancreas. 2. Synthetic drugs. Source: chemically produced in laboratories. Examples: aspirin, paracetamol. 3. Biotechnology-derived drugs. Source: produced through genetic engineering. Examples: erythropoietin for anemia, recombinant vaccines. B. Based on their mechanism of action. 1. Agonist drugs. Explanation: drugs that bind to a receptor and produce a biological effect similar to the natural ligand, substance that typically binds to the receptor. Example: albuterol, a beta-2 adrenergic agonist, used for bronchodilation in asthma. 2. Antagonist drugs. Explanation: drugs that bind to a receptor without triggering a response and block the action of agonists. Example: propranolol, a beta-adrenergic antagonist, for hypertension, blocking the effects of adrenaline. C. Based on their therapeutic effects. 1. Analgesic drugs. Function: relieve pain. Examples: morphine, opioid analgesic, ibuprofen, non-steroidal anti-inflammatory drug. 2. Antipyretic drugs. Function: lower fever. Examples: paracetamol, aspirin. 3. Anti-inflammatory drugs. Function: reduce inflammation. Examples: ibuprofen, corticosteroids, prednisolone. 3. Pharmacokinetics. A. Definition of pharmacokinetics. Pharmacokinetics is the science that studies the movement of drugs within the body, which includes the processes of absorption, distribution, metabolism, and elimination, ADME. B. Pharmacokinetic processes. 1. Absorption. Definition: the process by which a drug enters the bloodstream, typically through the digestive tract. Factors that affect absorption: formulation, different drug forms, tablet, capsule, injection, have varying absorption rates. Stomach acidity. Acidic drugs are more readily absorbed in the stomach, which has a low pH. Blood flow. The higher the blood flow to a region, the faster the absorption of the drug. 2. Distribution. Definition. Once absorbed, the drug is distributed throughout the body via the circulatory system. Factors that affect distribution. Protein binding. Drugs bound to plasma proteins, such as albumin, are pharmacologically inactive. Tissue penetration. Some drugs tend to accumulate in specific tissues, e.g., fat or brain. Blood-brain barrier. Certain drugs can cross the blood-brain barrier, such as psychotropic medications. 3. Metabolism. Definition. The process by which the body transforms the drug into more easily excreted metabolites, usually occurring in the liver. Factors that affect metabolism. Liver enzymes. Liver enzymes, particularly cytochrome P450, play a crucial role in drug metabolism. Microsomal versus non-microsomal metabolism. Microsomal metabolism involves enzymes within liver microsomes. 4. Elimination. Definition. The process of removing the drug from the body, primarily through the kidneys, urine, or liver, feces. Factors that affect elimination. Kidney function. Impaired kidney function can delay drug excretion. Drug formulation. Drugs bound to proteins are eliminated more slowly. 4. Pharmacodynamics. A definition of pharmacodynamics. Pharmacodynamics is the science that studies the biological effects of drugs on the body and how these effects occur after the drug interacts with the body. B. Mechanism of drug action. 1. Receptor interaction. Drugs work by binding to receptors on cells, triggering a biological response or inhibiting a normal biological response. Types of receptors. G-protein-coupled receptors. Activate intracellular signaling pathways. Enzyme receptors. Directly modulate enzyme activity upon drug binding. 2. Enzyme modulation. Some drugs work by enhancing or inhibiting the activity of enzymes in the body. Example: ACE inhibitors, angiotensin-converting enzyme inhibitors, used for hypertension. 3. Transporters and ion channels. Certain drugs affect the transport of ions or molecules across cell membranes. Example: antiepileptic drugs that modulate ion channels in the brain. 5. Drug dosage and selection. A drug dosage. Definition: dosage refers to the amount of drug required to achieve the desired therapeutic effect. Factors affecting dosage. 1. Age. Children and elderly patients may require lower or adjusted doses. 2. Body weight. Dosage may be adjusted based on the individual's weight to ensure effectiveness and reduce side effects. 3. Organ function. Patients with liver or kidney dysfunction may require adjusted doses. 4. Nutritional status. Poor nutrition can affect drug metabolism. B. Drug therapy. Goal. Tailor drug selection based on the clinical needs of the patient. Approach. Selecting the right drug based on its mechanism of action, indications, and potential side effects. Monitoring to ensure that the drug provided achieves optimal therapeutic benefit. 6. Side effects and toxicity. A side effects definition. Unwanted reactions that occur due to drug use at therapeutic doses. Examples of side effects. 1. Nausea and vomiting, common with chemotherapy drugs. 2. Gastrointestinal issues. Drugs like NSAIDs, ibuprofen, can cause stomach ulcers. B. Toxicity definition. Harmful effects that occur due to overdose or prolonged high-dose drug use. Examples. Paracetamol toxicity. Causes liver damage with overdose. Corticosteroids. Long-term use can lead to osteoporosis. 7. Drug interactions. A drug-drug interactions. 1. Synergistic interactions. Two drugs work together to produce a stronger effect than they would separately. 2. Antagonistic interactions. One drug reduces the effect of another drug when given together. B. Drug-food interactions. Certain foods can influence the absorption or metabolism of drugs. Example. Grapefruit juice can increase the concentration of drugs metabolized by cytochrome P450 enzymes. 8. Drug safety and use. A clinical trials. Before approval for widespread use, drugs must undergo several phases of clinical trials to ensure safety and efficacy. B. Drug regulation. FDA in the U.S. regulates the safety and effectiveness of drugs available